Hi there, everybody. It's Dr. Charlotte Hodges. Today, I wanted to talk a little bit about different revision bariatric surgery. I'll have a couple of different videos in this series, but it's certainly a topic that comes up a lot with my patients. I get a lot of second opinions from patients, and unfortunately, I also get quite a few patients. It's probably about 40% of my practice with patients coming in to see me if they've had old surgeries before in the past, whether they've had an old band, an old sleeve, and even an old bypass. I kind of want to touch on every one of these in some separate videos, so let's just dive right in. Today I want to talk a little bit about the lap band and undergoing lap band revision surgery. Now, probably about 15-20 years ago, lap bands were performed immensely. It was one of the fastest growing procedures that was performed in America. Now, the idea was, let's do a minimally invasive procedure that has very little downtime. It was an outpatient procedure, and the idea was that it'd be quick, easy, safe, and patients would have good outcomes. Now, unfortunately, what we're finding is that what those bands actually do is they really tighten down, they cause a lot of reflux, and patients were barely losing maybe 30% of their excess weight, and more than half of the patients that had undergone the procedure were now seeking out within 5 years a revision surgery, either because of complications from the band or simply that they just hadn't lost the weight that they wanted to lose. So what are some of the complications that people will have when they've had a band? The most common ones that I will hear is gastric reflux or heartburn that is just simply uncontrolled, even whenever they're taking medicine. They don't have a lot of good food tolerance, so even if patients would like to be able to eat healthier foods like chicken or salads, they simply aren't able to because the opening that the band will make is very small. So if food can't go down, it's going to come back up. So food intolerance, they also have a lot of pain associated with it as well. Sometimes not just where the band itself is, but where the actual port site is that's attached to the abdominal wall. So when patients will come to me, they'll come to me with some of these symptoms. A lot of my patients will also come to me that maybe they lost 20, 30 pounds and now they've regained all that back, and they really just want to be able to finally find a way to get the weight off. When patients come to me and they've had a former band, what my recommendation is to revise them to a surgery that's going to give them both restriction and malabsorption. A band is what I call a purely restrictive procedure, meaning it's just making the stomach small and limiting the amount of food that you can eat. And what all the research is showing is that when you have a purely restrictive procedure, what you want to do is kick it up a notch. A very, very popular procedure now that we perform, and I perform often in my practice, is a sleeve gastrectomy. It's similar to a band in that it is purely restrictive. I'm only making the stomach small. What I have really found in practice, though, is a sleeve is not an adequate procedure to revise someone to once they've had a band. They just aren't going to get the weight loss that they want, and they sometimes can end up developing reflux that's even worse than when they had the band to begin with. My 2 recommendations for patients when they come to see me is to either undergo a band to gastric bypass or a band to duodenal switch. Both of these procedures are performed laparoscopically. You're generally in the hospital overnight. You get to go home the following day. With all of my procedures, whether it's a straightforward sleeve, bypass, or duodenal switch, or even a revision surgery, patients all have the same recovery. If you're undergoing these surgeries and using insurance, you'll have the same insurance requirements. You have the same preoperative and postoperative diet. And best of all, you have the exact same surgical risk. So bleeding and infection happen about 5% of the time. Risk of leaks, the risk of a staple line coming apart, that's less than 1%. Mortality is 0.05%. These are all very low risk surgeries. What I also like to offer my revision band patients is one-stop shop. There are some surgeons out there that like to perform band revisions in a two-step procedure. I really haven't found that I need to do that. I'm able to laparoscopically remove the band, remove the port, and then also perform your preferred bariatric surgery all at the same time. I really haven't seen a need to perform this as a two-step procedure. The only time that I have found that I do need to perform it as a two-step procedure is if the band itself has begun to kind of erode through the stomach wall. And in that case, we know that beforehand going in during your preoperative workup, and we know that it will be a two-step procedure. So if there's anybody out there that has had an old band, whether you had it placed 5, 10, 15 years ago, if it was performed in another country, that does not keep you from having a good revision surgery. So I hope that this helps you guys out. I really want you guys to get to your weight loss goals. And if this information has helped you, give me a thumbs up and subscribe to my channel. Thanks so much. Bye.